Angela Koenig, U.S. Eastern Sales Manager for Nasco Healthcare, and myself, Stacey Haywood from Nasco Healthcare Canada. Take it away, Angie and Alex.
Good morning.
Good morning, I am Alex, the first patient communication simulator. Welcome to Nasco Healthcare's Distributor Training Webinar, all about me.
It's nice to see you today.
Before Angela gets started, this meeting is being recorded to allow for future viewing, which can be found in our vendor portal. I want to inform you that we cannot provide any technical support related to the internet or Zoom. Also, please feel free to ask questions in the chat section. Breaks will be taken to answer questions.
Thank you, Alex. Welcome, everyone. Nasco Healthcare's beloved simulator. We're very excited to kind of go over everything with you and let you see what Alex can offer. First, I'd like to start with his head to toe. Alex, from his head going down, on his right eye, you're going to have a camera that allows you to have patient perspective from where the patient sees everything coming at them, conversation, facial affect, and everything. Then you're going to have your carotid pulses that are up in his neck. You'll go down his body to the back up side of his shoulders, and he has two speakers, one on each side. Those are the speakers that you'll hear him talk to you from utilizing his AI. Then going down to the front of the body, he has heart sounds and lung sounds. His heart sounds are going to be a much smaller location utilizing the RFID tags with his smart scope that we utilize. This you can put your stethoscope into, or you can attach through this auxiliary cord. You're able to attach it to a speaker as well, so the whole group can hear. Secondly, you're going to have your lung sounds, which are going to be a larger area. Those lung sounds are going to be anterior and posterior to emulate the human body. On both sides of his arms, you're going to have a blood pressure cuff that once again can be used with the smart scope to hear the Kratkov sounds, or you can take a blood pressure with the radial pulse, a palpitile one. You also have brachial pulses, radial pulses. You have abdominal sounds on him. You also can do female or male catheterization. If you purchase the female kit, which Alex has, he does have a female. That catheterization though is a dry cath. Then going down to his bottom of his foot, on the top side of his feet, he has a dorsus pedis pulse. Does anyone have any questions? Stacey, you're on mute.
I don't have any questions at this point.
Okay, good. So with Alex, I'd like to kind of cover a couple topics before we go into the program. One, if you want to think about patients, I'd like you to think about 3 or 4 different types of patients that happen when they go into a hospital. One patient would be a patient that would be bleeding. In healthcare training, we don't ask that patient what's wrong. We just give them care. In another patient, you could have a mother having a child. Once again, normally we know that's going on, so we wouldn't ask a lot of questions if it was an emergency. We would just help her deliver that baby. And the next one would be a patient who had arrested, who has no pulse and isn't conscious. Obviously, we can't ask them anything. So with Alex, like 97% of all other patients that come into the hospital, we ask them what's wrong with them. From how have you been feeling? Do you have any problems? Are you feeling shortness of breath? Say if you had a patient who was maybe having asthma, knowing if they had asthma and asking questions relevant to their healthcare is important in patient safety, which is why I personally believe Alex, with my background of being a nurse, is an excellent addition to any program for a nursing, EMT, patient care technicians, even your CNAs, because in every instance, we all should be communicating with the people that we take care of. Now, to run Alex, some things we'd like to show you. Alex has a tablet that comes along with him. That tablet is whenever you deliver him, it helps get him on the internet. Since he is a cloud-based program, Alex, when you get the tablet, you actually turn it on, and there's a Firefox in the center of the screen, which I'm trying to get to show everyone. There we go. When you get your screen, there is this, and you would hit in the center here, which will pull up where your Alex is. Then it would begin to look for him. If you're using Ethernet connection or Wi-Fi at that time, that's when you would choose it and put in there. Once you get him set up, you would say that you were going to turn it on and power it up. If you connect it to the internet, then it gives you the ability to be able to be on Alex and choose your scenarios. I'm going to go to a screen share next to be able to show you the program running as we go through it, so you can see the different screens that we utilize. Just change my camera view really quick though. Screen, when you get to go in once you're logged into him, there we go. You would be able to see an Alex scenario that's sitting, your Alex would come up. And in this case, we're going to use this mannequin here. You would choose on the screen to start. And then in this case, what we did is we chose any Alex that you can have. We'll choose Alex Confused Quinn. The first time that you open Alex up, he'll offer every person of what's called a guided tour. This is okay, let's start. Proposes you and tells you how to start the mannequin and what to hit to start him. To choose the scenario. And then once you've chosen it, it will start coming up. Does anyone have any questions?
I have one question from back when you did the head to toe, Angela.
Yes.
The question was, can we use a real stethoscope?
You can. What you'll do is you'll put a real stethoscope through, grab the scope and I'll bring it. It's actually meant to be able to use the real stethoscope with this. So you'll actually place your stethoscope underneath the sound. Since this box is what we utilize to read the RFDI tag, that's why you will end up using this, because the sound's actually placed through this box so you can get a clearer, more a crystal clear emulant sound of whether it be heart sounds, lung sounds, or bowel sounds, or blood pressure at that matter. Any other questions?
Sorry. Thank you so much. That was the only question that was in the chat so far.
Okay, thank you. Inside of Alex's program here, if you'll see, when you come in, the first thing you get to see is the vital signs. And some things that are really neat about this is inside of our program, we allow for the defibrillator, which is the heart. So a heart with the little electric thing through it. That allows you to be able to increase your joules and charge it if you have a shockable rhythm. It also can be utilized as a pacemaker. You also have your built-in 12 lead that comes along with every rhythm for educational purposes. And then here, which is kind of neat, is the settings screen, which allows you to change how the screen is set up to be more like the screens that you utilize in your system or their systems already. Maybe the way where the blood pressure and everything is set up is different than what we offer it. So you can change those around just by clicking, unclicking and clicking them better. It's a better suit your needs. On the bottom here, I want to run through these really quick. This is what would be your patient file. The patient file is able to be built and you're able to put your own information in there through Google Docs. The next section is called orders. Anything that there are built-in orders inside of Alex that allow you to be able to possibly, if you want to see an ultrasound maybe on the specific one, you can come in and actually go down to the page. There we go. Oops, it doesn't have that one. How do I do the lab? There we go. And in this case, you can see the lab results that come up with that one. Then this is where we go back to our vital signs area. Now, if you wanted to make a change on your blood pressure or on your temperature, all you do is click on each one of these boxes and either type in your number or change it. And you could also create what's called trending by typing in that seconds area how long it's going to take for that to go through. Okay, same as well if you were to choose the rhythm strip area here. If you're looking at the rhythms, for some reason that stayed small on me. There we go. You can see that we have over 17 different rhythms as well inside of there. The next one is going to be the sounds, which I will need to stop this because it made me choose the wrong mannequin. Sorry, guys. There we go. In the sound section, This is where you can change your heart and lung sounds, but you can also type here.
Hello.
And Alex will speak with whatever you type there. You can also utilize this here, talk, push to talk, which allows you to utilize your voice through the mannequin as well. The next section that we have is, here we go, the video section, which is where it allows for his, what his camera eye to show, which I did not set up any record on here at this time, which I'll show you in the next section how to do that. And then there is the log. And as you can see, everything that we've said to Alex, or pulses or lung sounds that I do, I'm gonna step over there really quick and show you those again. Okay. Right here. When you're utilizing a stethoscope, I'm going to just do this over a speaker today so you can all hear the sounds. I'm just going to show you on the thing here. Now going back to the share screen, you'll be able to see that everything that I did with Alex actually came up on there. So when I did his radial pulse, I listened to his bowel sounds, all of those things record as you use that puck. Do we have any other questions?
I don't have any further questions at this time, Angela.
Okay. So this is how Alex's kind of program runs. The next thing is, inside of here is what's called a checklist. The checklist allows for Alex to be able to be facilitator utilized. The facilitator in this case would be able to check off on the screen whatever items were appropriate for things to change on. So let's say if you wanted them to identify the patient, they greeted them appropriately as an instructor, you could click that off. Did they ask the right pain questions? Did they listen to the heart and lung sounds? So this is how your instructor can interact as well then. I'm going to stop kind of inside of Alex here, and we're going to go to the inside of the program for the last few moments. Some things that he offers is, after you're running your scenarios, you have the ability to be able to go in and see your scenarios that you've run and your archives on them. So Alex here, oops. Are there more questions?
Nothing at this time.
I said, can we see when we touch the specific pulses? Yes, you can. It actually shows you in the specific location of where the pulse has been. So if it's the right radial or the brachial, dorsus pedis, wherever you do the pulse, carotid, all of that comes up. Alex also has built-in CPR, and since he's not laying down, I did not get a chance to show anyone that. But he does allow you also to see the compressions and ventilation, compressions and ventilations, depth and rate as well. Okay, so in the archive system, you'll be able to see there. Then the next thing is in patients. Alex comes with bundled patients. For the US clients, we have specific ones. We're very excited to tell you guys all about our new patients for the international group. What they have done is you have the ability to be able to change now. Let's see. If you go up here on the top of the screen in the patients and change the language, let's say to, let's go German. If we choose German, Alex, Deutsch will come up. You can open up that scenario. And when you open that scenario up, you would go to, say, your states. So he has no speaking capabilities inside of him at this moment on the international side of it. It's more of a blank template, allowing you or your users to be able to go in and type in your own language the questions and answers that you would want to have to help him kind of build his artificial intelligence. Fortunately for us in the US, we all speak English, and we have over 400 units that are out there right now. So every time we speak to Alex or anyone speaks to him, his brain continues to learn. So in your case and all the other international locations, as you speak to him and more locations have him, he'll continue to learn as you're typing in and having that artificial kind of building his brain for him to help him better understand. Does anyone have any questions regarding that? Okay. So in the Alex high level mannequin, we have a pro and we have the light, the pro, and the plus. In the pro mannequin, you're actually allowed to be able to run Alex as an avatar as well. So he has a virtual patient and he has a patient that's a full-bodied mannequin. In the full-body mannequin side of it, you would be in present with him, but during these uncertain times like COVID, the virtual patients tend to be very useful because the students can utilize them from outside of a classroom setting and access them via the internet. In that case, you'd be able to choose your avatar. Okay. In this case, you would be able to type your avatar in there. I'll open that back up again. Sorry. You choose your avatar, which there are, I believe, 10 or 12 avatars that we can choose from. Why is it not open? There we go. It's not opening up. Male, you can change your male and female. I don't think I can do that right now because it's a new one. I'll go back to my English one to show you. Okay, open. I know I'm doing wrong.
Copy it.
I'm going to just go into mine. I want to mine first. So this one here, it would be a copied scenario. So you can take all of your Alex scenarios. Say if you liked one of the bundled patients that come with it, Alex Quinn, you would open up Alex Quinn, hit copy to make an original copy for yourself. There we go. And once you copy it, you'll be able to change the avatars, which I believe there are 10 of them. You also can change the location if you were utilizing that virtual patient piece of it. And it gives you everywhere from home to the house to an ambulance, laying down or sitting up in a doctor's office or a hospital bed. The abilities, and then shedding your gender, male or female, the age of the patient as well. Alex's birthday is always April 11th, depending upon the age that you have him. So if you ask him his name and date of birth, he will give you a name and date of birth equal to that time. English speaking for this one here, is it going to be Great Britain or US English? And then if you want a limit on there or if you want to run it somewhere else. In the sharing capability, this is where you would assign, in this case, I copied this one and made it, but if I was going to share it with, say, Stacy, I would type her email address in and add her as a user. This allows her to be able to edit and make changes to it, add or delete it if she would like. In the resources section, this is where you would build in your objectives. The objectives are kind of set up where you can go in, you add an objective, and these are measurable objectives. So you can say you want to measure something. How you add your credits is you set the criteria at any time during this or in any order. You can have it specific. All of them have to happen in this order. It can be during the simulation, during the current state, or during any particular state that you have built. By adding criteria, you can set your criteria based on the log entry. Maybe if you want it to be specific to blood pressure, blood pressure, I think it's our heart, lung sounds or heart sounds, listen to heart sounds, listen to lung sounds, are two of the choices you can utilize so that when you auscultate it, that they'll get credit for doing that. So you would do log entry. If the vital signs, maybe you make a change in there, or a checklist item, or how much time has passed, are all ways you can set that criteria in here. Okay, and you can give it points. The checklist, like you went through and checked, you're able to keep this or automate it and change it any way you would like. The Lifeline for Learners is a good place to put information of how your how your students are going to interact with your mannequin. And then the patient file, which is where you build a Google Doc to be able to show you what's going on. In this case, in this patient here, you can see they have access to it. and then the editable links that go along with it as well. Those things tend to need access to request them. Okay, there. Next is your states. In your states is where you would make your changes. What you would do is you go into states, and this is when you're writing a scenario. You open up that state. You see the vital signs. You can click on sounds. Sounds is where you would make all your initial changes. Conversation. Conversation is the brain of Alex, which is a little slow right now, I see. Okay. So he works on a category system. First, we'll look at the category of greeting. In your greeting section, there are over 11 topics and responses that Alex has, and we'll just choose greeting on the top one here. So for Alex here, greeting, anytime you they would walk up to him and speak to him, you will see there are 22 ways to say hi, apparently in English, to Alex right now. And when you say hi, greeting to him, he is going to respond to you, hello, how are you back? In all of these situations, it works the same way, just like present illness. Currently in the English version, we have over 78 different categories that have questions and stuff inside of here, are asking him different questions and communication skills built up for empathy and everything else. So when looking at it internationally, you can use that same template to be able to add them in as well. If it's your own scenario, you can add your own category by clicking add category, topic, add topic, and same as questions. If you'd like to filter out and look for something in particular, you can type in, I'm starting to look at diabetes here, but it will continue to go into and kind of limit where the questions go into. Family history, major diseases, it'll pull out anything. So it is really nice to be able to filter. Okay. And then the last one there would be the about section. And if you wanted to add another state, you could. So we'll say, okay. What I tend to do when I'm building a state or building a scenario is I like to start out with my initial state, fill out the full communication of that patient. And then I copy the states after that if I would like to have more of them, because the conversation only changes based upon what changes happen in that state. So if they were in pain in the first state, then in the second state, if they received medication, you could change the answer to, I feel better now, thank you. So it's much easier if you build out the first time. Does anyone have any questions about Alex is or how Alex runs?
I don't have any questions in the chat right now, Angela.
Okay. Well, I just wanted to thank everybody and let you know that Alex comes in a light skin tone and a medium skin tone. He also has the female skin and an optional IV arm as well that you can add on to him. I've had many, or her at that time. The languages and voices, Alex has languages and voices are apparently at different ages. So the tone of the mannequin's voice at the time of the ages you choose will change based upon if he's younger, if he's older, or female. All of those things change accordingly with it. With Alex's camera eye, when it's running, it is a kind of fishbowl effect. So if you need to be able to have a patient, I tend to have Alex set up personally myself so that I'm always on the right-hand side of him, or the student walks into the right-hand side. His microphone for him to listen is the top of his right thigh. And with his camera being in the right eye, it's easier to interact if you're entering from the right side with him. I personally don't always lay him in a bed. I like sitting him up so I can engage with him and get people used to that. I don't know how it is for you guys in other countries, but for us here, I think the student population with more of the cellular usage these days are less apt to be good at communication skills, as I think you grow into that and develop it better. And I think that's why Alex is so important in Nasco Healthcare, because we are trying to build better communication within healthcare providers every day.
Fantastic. I do want to mention that there is a sell sheet in the chat. It's also posted in the portal. And also a video of this training session will be posted in the portal. It usually takes about a week for us to edit them so that you can go in and watch and share with your sales staff. If there are any questions before we end this meeting, please type them in the chat immediately. If not, then we will likely end this meeting in about another minute or so. I'm just watching the chat here, Angela, and I'm waiting to see if anybody just needs a second to get their question in.
Sure.
That is the medium skin, Alex, that you have?
Yes. The light-skinned Alex has blue eyes and the medium-skinned Alex has the brown eyes. That's how you can kind of tell with them. And
we can send you images of the female as well if you need some. Just contact us. I'll put my email address here.
Or they can contact their reps in their area. I'll make sure to share with Leah and all of them. We'll share with them photos of Alex. I have some photos of Alex where I've made him up as a female with his wig and everything. He's a much better looking woman than he is man, I think.
Fantastic. So we don't have any specific questions. We do have a request to send the link of this video session. So the video will be in the portal. Rima, thank you so much for your question. And I think that's it. Angie, thank you so much. You did a fantastic job. And thank you, Alex, for coming today.
He's a little shy now. I turned him off. Thank you, everyone. It's been a pleasure.
Okay, fantastic. Have a great day.
You too.